Katie.
Hi.
Welcome to the office.
Thank you.
How are you feeling today?
Good. Just ready to get a
Perfect.
checkup after having my baby.
Okay, congratulations. So I have just a couple things to go over with you. Obviously, your name is Katie, correct?
Yep.
Perfect. My name is Dr. Perez. I have your age as 25 years old.
Mhm.
Perfect. So you're here for an annual female health exam. I have you on a regular diet. You don't need any special diet at home, vegan,
No.
vegetarian, anything like that?
No.
Perfect. Any food allergies?
No.
Okay. Just in case of an emergency, I have you down as a full code.
Mhm.
Okay. And you are able to use the restroom independently at this time?
Mhm.
Okay. If you need to go, just let me know.
Okay.
All right. So I have you up ad lib, which means you're independent at baseline. You're able to complete your daily tasks
Yes.
independently. Okay. Perfect. Just making sure, since you are new to the office and there's no changes in any of that since you've had your baby.
Yeah. Everything's good.
Perfect. So that looks fine. So now I'm going to ask you some questions about your history, and some of these are kind of personal, so if you want to decline to answer, that's fine, just let me know.
Okay.
So what is your preferred gender identity?
Female.
Perfect. And your preferred pronouns?
She. Her.
Perfect. And you are a female at birth, obviously.
Yep.
Perfect. And what is your current relationship status?
In a relationship.
Okay, and is that with a male, female,
A male.
biological male?
Yep.
Perfect. And do you currently have more than one sex partner?
No.
Perfect. And are you currently on birth control?
No.
Not yet.
Not yet.
Okay. Are you interested in birth control at
Yes.
this time? Okay. So that's something that we can discuss later on. Okay. So you obviously just had a baby. How many times have you been pregnant?
One.
And then the one to term. Any complications with that?
Nope. Easy.
Okay. And you have one child, and that is a boy.
Boy.
And how many days or months is he at this time?
He is 24 months, 2 years.
24 months, perfect. Okay, did you breastfeed?
Yes.
Okay, are you still breastfeeding?
Nope.
How long did you breastfeed for?
About 6 months.
Perfect. Any complications with that?
Nope.
Okay. So these next questions are a little more personal. Did you have any issues with PPD or postpartum depression?
No.
Any history of hormonal imbalances, either related or unrelated to your
No.
pregnancy? Okay. And do you feel like your hormones are adequately balanced at this time? Any
Yeah.
issues with mood swings or anything like that?
No.
Perfect. Just taking a couple notes. Okay. All right, so the next couple of questions I'm just going to let you know are going to be about sexual assault. So if you'd like to decline to answer, just let me know, but they are a little more personal, okay?
Okay.
So do you have any history of sexual assault that you wish to disclose at this time?
No.
Any current sexual assault happening at home?
No.
Are you safe in your current household?
Mhm.
And do you feel safe to return home today?
Yes.
Perfect. Okay. If I need to call you with any information, is it okay to leave a voicemail,
Mhm.
text message, or email?
Yes.
And do you need me to give a code word, or is it okay to leave detailed information?
Yep.
Perfect. And then just for purposes of the exam, I would like you to give me a code word that you would like to use in case of you wanted me to stop any part of the exam. So what word would you like to use?
No, thank you.
Okay. Perfect. So if at any point during the exam you're uncomfortable or you want me to stop something, just say no thank you and I will stop, okay?
Okay.
Perfect. And do you know when your last menstrual cycle was? Have you started since you've had your child?
Yeah. It was probably 3 weeks ago.
3 weeks ago. And
Yeah.
are you having normal menstrual cycles at this time?
Yes.
Perfect. Have you ever had any abnormalities with your menstrual cycle?
Not since being an adult.
Okay. Perfect. And do you have any health concerns regarding your breast, your vagina, otherwise anything abnormal that you'd like to discuss?
Nope, everything seems normal to me.
Perfect. Okay. All right. Alright, so let's go ahead and get started. I want you to go ahead and use the restroom if you can. I have a sample cup that I'm going to give you here.
Okay.
So if you could fill this up for me up to that third line where it says 40, there's a little tray that you can leave it on, and then go ahead and come back in and I'll have you change it to a gown, okay?
Okay.
Alright, so I will hand you that, and the restroom is just outside the door.
Okay.
Thank you. Alright, Katie, thank you so much for your sample. We will get that sent over to the lab. It should be coming back before your exam is over. I can let you know if there was anything abnormal with that. So at this time, I'm going to step out and allow you to place this gown on. I want you to put it on with the open side to the front. So you're going to take your top off. You can leave your shorts on for now, okay?
Okay.
So I'll give you a couple minutes and I'll be right back.
Okay. Thank you.
All right, Katie, are you comfortable? Perfect. Okay, so I'm just going to put a drape over your lap just to give you a little bit of privacy. And we will go ahead and get started with the thyroid portion of the exam. So I just want to have a look at your neck, if that's all right.
Yep.
So I'm just going to see if there's any signs of notable swelling or any lymph nodes that look abnormal. Just let me grab my pen light. Just shining a light on your neck. So I'm not seeing anything that looks like a swollen nodule or anything like that. Do you have any pain or discomfort in any of these areas?
No.
Okay. Just gonna have a look at your clavicle. So all of that looks pretty healthy. I'm not seeing any signs of swollen lymph nodes, which is good. So I will go ahead and check that off. So let's get started with your breast exam.
Okay.
Okay, so I am going to have you hold this up if that's okay. And I'm going to be palpating around your breast and nipple area. So just let me know if any of it's painful or uncomfortable, and then obviously use your safe word, okay? Okay, so just having a look with my pen light, looking for any signs of asymmetry between the breasts. They do look pretty even. Not seeing any lumps or bumps that are noticeable from the outside. And you're not currently having any issues with nipple discharge or anything like that, correct? Okay. Okay, perfect. So you're just gonna feel me palpate around. I'll be using 2 to 3 fingers to move in a circular motion around your breast, okay?
Okay.
So just looking for anything that might feel like abnormal tissue or any thickening of the tissue.
Okay.
Obviously looking for any abnormal lumps that could be an indicator of breast cancer. You are very young, so I don't think we should have any issues there, but obviously we want to be safe. And there can be some kind of normal changes with pregnancy, so obviously we're just checking for that as well. Just having a look at this side, and so far not noticing anything abnormal. Breast tissue feels healthy, normally fibrous. It's not thick or thicker than it should be.
Okay.
Okay, so I'm gonna have you hold your breath, and I'm gonna kind of scoop up under your breast, okay?
Okay.
So 1, 2, 3, hold. Good, and you can let go. And then we'll do that again on this side. 1, 2, 3, hold. Good, and let go. Perfect. And then if I can have you raise this hand up above your head. So there you go. So I'm going to be feeling your armpit, just feeling for any kind of abnormal lymph nodes. I know it's ticklish. I apologize. Okay, so not noticing any abnormal lumps there. Tissue feels healthy. No signs of hyperhidrosis. Okay, so let's go ahead and do the other side. So I'll have you raise this arm up above your head. And I'll just feel it here. And again, tissue feels normal. Not noticing any signs of hyperhidrosis, and then I just want to have a look. Hair growth appears normal. Okay, so go ahead and relax your arm for me. So I'm gonna start with the abdominal exam, okay? So I will be opening your gown and exposing your abdomen. Breasts will be covered, and I'll have your pelvis covered for this portion of the exam, okay?
Okay.
All right, Katie, everything looked normal with your breast exam. I did not notice any abnormalities. There are no signs of any kind of lumps or bumps. There's no abnormal nipple discharge. Your lymph nodes under your armpits or your axillary area look totally normal, so I'm not worried that there's any signs of breast cancer or any cysts or even blocked milk ducts that could still happen after pregnancy. So you're all good with that. So let's go ahead and move on to the abdominal portion of the exam. And I'm just gonna grab a couple of tools here. I have a couple different things that I'll be using. Okay, so let's go ahead and get started. I'm just gonna start with the visual inspection. So just taking my pen light and having a look at your stomach. Looking at your breathing as well as your skin. So far, everything appears normal. I do have a couple freckles, but they look fine. They're not raised or asymmetrical in shape. Skin color and texture is normal for age and ethnicity, which is good. And you do not appear to be dehydrated.
Okay.
Umbilicus appears normal. Doesn't appear that you've ever had your belly button pierced.
Never.
And I'm not noticing any sense of complication at birth, so that's good. Okay, no visible stretch marks or any other abnormalities of the skin. Okay, so overall you look healthy. Let's go ahead and get started with some palpations. So again, I'm going to be using 2 to 3 fingers, and you will feel me kind of gently at first, pushing around on your abdomen, okay?
Yep.
So just getting started with a few gentle palpations. Perfect. My abdomen is soft and tender. Noticing any abnormal firmness or any signs of bloating. Just going to feel at the base of your breastbone, which appears to be intact, and I am able to palpate your ribs normally. Any pain or tenderness here? And are you having normal bowel movements? When was your last bowel movement?
This morning.
And it was normal, no diarrhea or anything? Okay. And are you ever constipated? Definitely not noticing any signs of bloating, so your diet appears to be working for your digestive system. So now you're going to feel me palpate a little bit deeper, and this time I'm feeling for your organs, okay? This might feel a little odd. For your intestines, which are normal. I'm going to be pulling up here, palpating a little deeper, just looking for any signs of umbilical hernia, which would be a hernia below your belly button, but I'm not noticing that. Okay. So I'm going to take my stethoscope and have a listen to your bowels. It's going to be a little cold. Okay, so bowel sounds are active. Can I have you breathe in deeply and then hold your breath for me?
Okay.
And release. And one more time. And release. Very good. Okay. No issues there. Bowel sounds are normal. You appear to be digesting your food normally, and I'm not noticing any other abnormalities. So I am going to take my reflex hammer, and you'll just feel me do kind of a light tap along your belly, okay?
Okay.
I'm sure you can hear that hollow sound is what we're looking for.
Okay.
Very good. Okay. And then is there any pain or tenderness as I kind of percuss along your rib cage here?
No.
Okay. And here. Okay, very good. So for the last portion of your abdominal exam, I'm going to be performing a sensation test. So I'm just saying if there's any issues with sensory loss or any abnormalities from one side or the other that could indicate a neurological dysfunction, okay?
Okay.
So to start, I have just a cotton wisp here. It's gonna feel like this. I'm gonna run it along your stomach. At first, you don't have to say anything. I'm just looking for a normal reaction in your muscles, okay? So it might tickle just a little. Perfect, okay. So now if you can, I'd like you to close your eyes, and as you feel it touch your skin, I just want you to say yes.
Okay. Yes. 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 Yes.
Perfect. So we're gonna do the same thing. This time you're gonna feel this side, which is a little sharper.
Mhm.
So just say yes when you feel it.
Yes. 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 Yes.
Okay, sorry, I know that is pretty ticklish.
Tickles.
So this time we're gonna alternate sides. So
Okay.
this will be soft and this will be sharp, and you just indicate which side you feel.
Okay. Soft. 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 Hard. Harder. Harder. Soft. Soft. Hard. Hard. Soft. Soft. Hard. Soft.
Very good. Okay.
Did I get those right?
You got all of them right. You did very well.
It's a little hard.
So moving on from that, we're gonna do something similar. This time I have what's actually an acupressure tool, but you're gonna feel me just press it into your skin. I might do it softly, I might do it a little deeper, just say yes if you feel it.
Okay. Yes. 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 Yes.
Very good. Now this test is a little bit harder. If you don't get it correct, it's okay. Can you feel the difference between this point and this one?
I don't know if I can feel it.
So one is just a little more surface area. So this one is smaller and this one is larger.
Okay.
So this will be 1 and this will be 2.
Okay.
If you can't tell the difference, don't worry about it, okay?
Okay. 2. 2. 2. 2. 2. 2. 2. 2. 2.
Okay. That's okay. That test is very difficult, so you weren't able to tell, but that's all right. So we're going to move on, and this time I'm going to be using what looks like a pair of tweezers. So I'm going to do a light, very gentle pinch, and I want you to just say yes if you feel it.
Okay. Yes. 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 Yes.
Very good. No issues with that. All right, Katie, so let's go ahead and move on. So this time I have a little brush, and I'm going to brush this along your stomach, and you just say yes if you feel it. I will warn you, this one is usually tickling people, so just want to let you know.
Yes. 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 Yes.
Very good. So I did get a normal reaction there. And now I'm going to move on to the Wartenberg wheel, which is probably the most ticklish of the bunch. So it is pretty spiky. It's not going to hurt you, but it is a very distinct sharp. So you'll feel me run it along your skin. I want you to tell me if it feels any differently from one side to the other. So I'll do it on one side and then the opposite, and you just let me know if it doesn't feel the same.
Okay.
So this side compared to this side, does that feel the same?
Yeah, it tickles more right here than
More on this side, okay. And here, and here,
same.
same. Here, and here. And then if we do top, bottom,
Same.
and then kind of midline, top, bottom.
Same.
And over your belly button is not any more sensitive than anywhere else, correct?
No.
More ticklish here
Yeah.
on the sides, I would imagine,
Yeah.
compared to here.
Yeah.
Okay. Very good. So now I'm going to use an object that's fairly cold. Can you tell that that's cold?
Yeah.
So I just want you to say yes if you feel it.
Okay.
And if it gets any warmer,
Yes.
anywhere on your stomach.
Yes. 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 Yes.
Perfect. And can you feel vibration here?
No. I don't feel vibration. I feel you touch me though.
Do you feel vibration here?
Yeah.
Here?
Not really.
No? But you feel that it's cold?
Yeah.
Okay.
I felt vibration that time.
Okay. So you feel this, and it stops as it touches you?
Yeah.
Okay, that's fine. So you're just a little more sensitive in your hands than you are in your belly, but you are able to feel it, so that's okay.
Okay.
And then the last thing I want to do is I'm going to use the end tip here, and you don't have to close your eyes. I'm just going to run this along the middle of your stomach, and I'm just looking for a reaction in your muscles, okay?
Okay.
It's reacting, so here's this side. There we go. So getting a normal reaction there. Very good. Okay. So let me just jot down a couple of notes here.
Okay.
And we will go ahead and move on to your pelvic exam after this, okay?
Okay.
So I didn't notice any abnormalities in your abdomen. Bowel sounds were normal, sensation test was perfect. You missed a couple, but they're nothing that would be considered abnormal.
Okay. It was a kind of hard test.
It is kind of difficult. You don't, you get touched in your stomach, but not in that way by other people, so it can be kind of odd. It's hard to tell the difference as far as when I do it on your hands, you're more likely to know what it is, but on your stomach it is difficult.
Yeah.
Okay. Alright, so I am going to go ahead and get set up for your pelvic exam. Now, as far as atmosphere in the room, I did want to get it set up to your preference just so you can be comfortable, because obviously it is an invasive exam. So when you filled out your appointment card, you did say that you preferred pink or purple light, so I will accommodate that. You asked for dim lighting with a candle, which I do have, and then you wanted a melon scented sachet, which I do have, and I will give to you before we get started, okay? Okay. So let me get all of that set up for you, and then we will come back and we'll get started, and I'll explain the rest of the exam.
Okay, thank you.
Perfect. All right, Katie, are you feeling comfortable?
Yes.
Okay, perfect. So before we get started with your pelvic exam, I'm going to go ahead and hand you this. You're welcome to open it and keep it up there with you. This is your aromatherapy patch, and it is in the scent that you requested. So I will hand you that, and I hope that brings you a little bit of comfort. I'm going to go ahead and sanitize my hands before I put my gloves on. And then I did just want to remind you, of course, that your safe word is no thank you, and if at any point if you'd like me to stop, just verbalize that, and I will. You can also obviously just say stop.
Okay.
Are we doing okay as far as the lighting? Is this the color that you're comfortable with?
Yes.
Okay, and then I do have your candle here. So let me know if there's anything else that I can do for you. This part of the exam is pretty brief, so it shouldn't take too long. Okay, so to get started, you are going to feel my hands. I'm going to start by just palpating with my fingers, just like this, on the inner parts of your thigh, and I'm just looking for any abnormalities in the tissue there, like any kind of cyst or anything like that, okay?
Okay.
So not touching the private areas just yet, just the inner parts of your thigh. Okay. Just feeling around, looking for any signs of abnormality. This is an area that gets a lot of friction, so we can sometimes get heat bumps or cysts in this area from excess heat being trapped as well as sweat, but I'm not feeling any of that. And do you typically wear cotton underwear or cotton lined underwear?
Yeah, I do.
Perfect.
I try to always.
Definitely want to make sure we're doing that, especially if you're out and about or being active. It's just a lot more breathable of a material, and it's a lot safer for you. Okay. So now I'm going to move on to doing an exam of the outside of your vaginal area. So I'm not going inside just yet. I'm just going to be feeling around your labia and your mons pubis area, which is the top, just to feel for any abnormalities there, okay? So you are going to feel my hands.
Okay.
Just gently palpating here. So I'm not feeling anything that's concerning so far. Alright, so there's no signs or symptoms of anything abnormal in this area. So what I'm going to do is prep my speculum, which is the device I'll be inserting into your vagina. It is cold metal. I do just want to warn you, it can be uncomfortable. In some cases it can be painful, but I don't suspect we'll have issues with that today. I do have the smaller size speculum. If it does become painful, just let me know, okay?
Okay.
So I'm gonna set that here, and then obviously I have some lubricant, and this has been warmed, so hopefully it shouldn't be too cold for you.
Okay.
And I have a couple different swabs. I will be getting a couple samples here just to complete our exam. So I have the swab for your pap. It just looks like this.
Okay.
So this will be for your pap smear, which is testing for cervical cancer. And then I also have these swabs here, and this will just be testing for any regular abnormalities aside from the urine sample that we got from you, just looking for any signs of abnormal bacteria with this one.
Okay.
And then the last one I have here is this red tube. There are 2 swabs, and this is your STD screen, okay? So this is checking for any syphilis, gonorrhea, HIV, anything like that, okay? So
Okay.
I will be gathering these samples, and then we will get those sent over to the lab. So your urine sample actually came back, and the results for that were normal, so there's no signs or symptoms of UTI, and you are not pregnant at this time.
Okay.
And then these have to be sent off to an outside source lab, so the results take a little bit longer. So in about 48 hours, they will be updated to your patient portal, and then if there are any abnormal results, I will give you a call, okay?
Okay.
Okay. All right, Katie, so let's go ahead and get started with your vaginal exam. So what I'm going to do first is be inserting my fingers. So I'm going to place a little bit of this lubricant onto my first two fingers, and I will be inserting them slowly. I'll let you know before I do that, and you let me know if that's painful or uncomfortable for you, okay?
Okay.
Okay. So I'm just getting some of this lubricant onto my fingers here. Okay. So I am going to go ahead and insert on the count of 3. 1, 2, 3. Perfect. And I'm going to rotate my hand upwards and just feeling around the inside of your vaginal canal, feeling for any abnormalities, any signs of polyps or cysts. Going a little bit deeper now, trying to palpate your cervix, feeling for any abnormalities there. And so far, everything feels healthy and normal. Any pain or discomfort here?
No.
Okay. So you're going to feel me push down with a little more pressure. Okay, just not feeling anything abnormal there, which is very good. Okay. So I am going to remove my fingers. And now I'm going to be going in with my speculum. And it looks like this, cold metal. So I will be applying the lubricant to this area, and then you're going to feel me insert on the count of 3, okay?
Okay.
So 1, 2, 3, inserting my speculum. Is that feel okay so far?
Yes.
Okay. So now that I have my speculum in, I'm going to go ahead and open it so that I can access your cervix. And I'm going to begin collecting my samples. So like I said, that first one is going to be the pap. So you're going to feel a little brush. It might feel a little scratchy, but it shouldn't cause you any pain.
Okay.
Just rotating that around to make sure we get a good sample. Okay. Perfect. So I'm going in with my second set here. And these two are testing for any abnormal bacteria.
Okay.
Just going to rotate these around 360 and make sure that we get a healthy sample. Perfect. Okay. And the last one is your STD screening. So it looks like this. Just going to insert that inside. This one does have to go a little bit deeper.
Okay.
Perfect. And just making sure this is incorporated well. Okay. Get that all sent off to the lab. And I just have a little sterile gauze here that I'll use to clean off some of that excess lubricant. So it just looks like this. It's a sterile cloth. I'm just going to clean off the excess lubricant from the outside of your vaginal canal. Okay. All right, Katie, we are all done with the pelvic exam. So if you'd like, you can go ahead and have a seat and we'll go over a couple things before I let you go, okay? Perfect. All right, so let's just go over a couple of things here.
Okay.
So your pelvic exam from an outward perspective was completely normal.
Okay.
I didn't see anything that, would appear to be any signs of abnormal discharge, it wasn't abnormally discolored, it was clear and normal. It was mucousy, but that is normal. Normal for this part of your ovulation cycle. You are 3 weeks out from your period, so you are starting to ovulate again, which is good.
Okay.
Okay. Didn't feel any signs or symptoms of polyps or cysts. You're not having any abnormal symptoms as it is, so we don't need to order anything like a transvaginal ultrasound or anything like that. So the only thing we would be worried about is that STD screening, which should be coming back within the next 48 hours, and then that's something that we can discuss from there. So I will call you if there are any abnormal results. Would you like me to call you if the results are normal, or are you able to check your patient portal?
Yeah,
Okay.
I can check the portal.
Perfect. Okay. So the last thing that I wanted to just go over is, as you know, we are a female health clinic, so we handle everything female health, whether it's breast exams, abdominal exams. We can refer you to a PCP if you're looking for a regular doctor. We also have the OB section that can handle everything with your baby care, but I know that you do already have a pediatrician for your child, correct?
Yeah.
So we also specialize in advocacy for females, bio or non-bio. So we do work with the LGBTQIA plus community. So if you know anyone who needs any therapy or outreach with that, you can refer them to us and we can help them.
Okay.
We also have many different therapies that we can refer you to if you need it, like psychiatry or a regular therapist that you'd see on a weekly basis. We also have food assistance such as SNAP and those kind of programs that we can equip you with if need be, okay?
Okay.
Okay. So before I send you home, I do just want to ask again, are you safe to go back to your living environment today?
Yes.
Okay. Perfect. And do you need a referral to any of the following? Psych?
No.
Okay. Therapy?
No.
Perfect. Any nutrition, like a nutritionist or any food bank, SNAP assistance, anything like that? Okay. And do you have a regular PCP?
Yes.
Okay. Okay. And any need for any financial assistance for any reason at this time?
No.
Okay. And you said no to SNAP. Do you need any WIC or Fresh Start, which would help benefit your child if you needed any food for him?
I think I'm okay.
Perfect. And any job referral needs at this time?
No.
Do you have any questions for me?
No.
Okay.
This was great.
Good. I'm glad you enjoyed it. I know coming to the gynecologist can be scary, but we try to make it as relaxing as we can. So I would love for you to come back in a year. Ideally, we would have you pre-schedule that appointment with the receptionist up front, but if you'd like, you can obviously call back or make an appointment on the patient portal. It's up to you, okay?
Okay. Thank you.
Thank you so much, Katie. I appreciate you for coming in today.
Thank you.